Hello, everyone. Welcome to the TA Marketplace Vendor Fair. Jasmine, would you like to kick us off on the next slide?
Yes, thank you.
Much.
All right, perfect. So my name is Jasmine Garcia. I'm the chief of the Providing Access and Transforming Health unit. The chief of our Managed Care Program Oversight branch is Michael Weezar, and the chief of our Project Coordination section is Shell Wong. And joining us today is our third-party administrator public consulting group. We have Trish Perizzelli, our TA Marketplace lead, Eliza Met, our vendor services lead, Jenna Wall, our cross workstream lead, and Danielle Feldman, our TA Marketplace project manager. And we can hop to the next slide. Thank you so much. So our goals for today. So we want to provide an orientation to the TA vendor fairs and then showcase TA vendors and their services and projects, and also share TA Marketplace resources and updates. And then we'll definitely be leaving time for open Q&A. And next slide, please. Thank you. So the purpose of the virtual vendor fair is really just an opportunity for vendors to share information about their organization and services to potential TA recipients and support utilization of the TA Marketplace. 5 virtual vendor fairs will be held, and we started with these in February of this year, and they'll go through this month, split across the 7 TA domains. And I'll pass this over to Jenna. Thank you.
Great, thanks so much, Jasmine. So today's vendor fair is actually focused on 2 domains. So for those of you who had joined us in the past, we were only focusing on 1, but today is extra special because we are focused on 2. The first of which is domain 2, which is community supports, strengthening services that address the social drivers of health. So we have several vendors who are approved in domain 2 today, and those vendors have the expertise to help recipients design, implement, and improve one or more of the Medi-Cal community support services. So on the slide, you can see a few examples of the potential technical assistance projects that might be included in this domain, though, of course, they are not limited. And I will just flag that all of these slides will be shared with attendees following today's event. We go to the next slide. The second domain for which we are having this event today is domain 7, which is focused on workforce. So again, we have several vendors that are approved in domain 7. And these vendors have the expertise to help you all recruit, retain, a well-prepared and high-performing workforce with a focus on members on the frontline, clinical, and/or lived experience. So again, we also have examples of potential technical assistance in this domain. So for example, supporting forging relationships with local colleges for workforce pipelines, etc. And all of these descriptions are also available on the TA Marketplace website. So we are joined today by vendors who are approved in either domain 2, domain 7, or actually both domains 2 and 7. Next slide, please. So our high-level agenda today, so we've already had our welcome and introduction. And shortly, we will have our vendor pitches. Then we will all be moving to breakout rooms. I will be providing a little bit more context about how the breakout rooms work and how you will be sorted and can move around between those breakout rooms. And finally, we will close with just some resources for you all regarding the TA Marketplace, as well as an opportunity for Q&A regarding the TA Marketplace in general. We can go to the next slide. So just before we begin, a few little items regarding Zoom logistics. So please be sure that you have the Zoom application downloaded to your device to ensure that you are able to participate fully in this event. Without joining via the Zoom application, you will not be able to join those breakout rooms later in the event. So if you've joined by phone or by browser, we just ask at this time that you rejoin via the Zoom app. Additionally, we ask that you use the Q&A functionality to ask any general inquiries regarding the TA Marketplace, or if you're experiencing any technical issues, we will work with you through that manner. But we do ask that you save any of your vendor-specific questions for those breakout rooms, as that's the intent of this. Those breakout rooms is to ask questions to the vendors themselves. We can go to the next slide. All right, so just a little bit of information regarding the vendor pitches. We can go to the next slide. So vendors will be presenting in alphabetical order. Vendors will have 1 minute to present their organization, And again, we just ask that you hold those specific vendor questions for those breakout sessions. We will not be answering any questions for vendors during this time. So with that, I think we can move to the next slide where we have our first vendor, 43 Strategic Consulting.
Wonderful. Just confirming everyone can hear me okay? Hi, everyone. My name is Stella Sappho. I'm an HIV primary care physician with a background in systems design and health equity. I'm proud to be here representing 43 Consulting Group. We are a women of color owned and led company with over 75% of our team coming from historically marginalized backgrounds. So for this reason, we center equity as central to our mission. In addition to doctors and clinicians like myself, our team includes administrators, executives, and public health practitioners with expertise in Medicaid, addressing social determinants of health, care management, value-based payment delivery, and primary care redesign. Some of our projects have evaluated issues affecting digital equity, housing, and workforce, just to name a few. So our particular focus at 43 Consulting is to collaborate with community-based organizations who are contracting with health plans for the first time. And in this capacity, we provide coaching and end-to-end support to co-create solutions that really improve the health outcomes for our patient populations. And so to recap, 43 Consulting Group is a fit if you want a team with a diverse background that centers equity in our mission and uses a multidisciplinary focus to provide coaching, trainings, and technical support for service organizations. And we really look forward to sharing more about how we can partner. And you can join us in breakout room 4, where we'll be able to share more information. Thank you.
Thank you so much, Stella. We can go to the next slide where we have Apps Global.
Good morning. I'm Katie Sheedy from Apt Global, a consulting firm with a 60-year history focusing on improving the quality of life and economic well-being of people worldwide. We have decades of experience providing training and TA resources for a diverse array of community-based recipients across a wide range of topics, including housing, TA to organizations throughout the state of California. We've developed a highly flexible and responsive approach to designing and implementing training and TA and are available to support you across all 7 domains. In domain 2 and 7, we can support your organization in identifying the areas in which it needs to build the capacity and infrastructure to implement ECM and community supports. And some examples of TA might include building capacity of homeless systems and housing programs, supporting frontline staff like CHWs and lived experts through training and job aids, and developing performance measures and data dashboards to help you track progress and evaluate your programs. I hope to see you in a bit in breakout room 7. Thanks.
Hey, thanks so much, Caitlin. And next we have Advocates for Human Potential.
Good morning. My name is John Brumbach, and I'm with Advocates for Human Potential, or AHP. We're a consulting, training, and technical assistance firm with nearly 40 years experience supporting transformational changes to the behavioral health and social safety net systems. We work at every level, from implementing state and federal government initiatives to working directly with local organizations to maximize their efforts to address health-related social needs. We have deep California roots with an office in Pasadena and nearly 100 California-based staff maintaining extensive experience in both workforce development and community supports domains. With over a dozen off-the-shelf offerings in both of those domains, we bring our full experience to bear to address the variety of needs under this initiative. And furthermore, we prioritize meeting you where you are at, building TA and trainings to achieve your specific goals via means most impactful to you and your team. I look forward to talking with you all more in breakout room 7.
Thank you so much. Next we have Alterum. Sorry, thank you.
Thank you. Good morning. I'm Maggie Fairchild, and I support business development with Alterum. We are a nonprofit organization, and everything we do is focused solely on health. Our team has particular expertise within Medicaid, in particular around supporting long-term services and supports, dual eligible programs, and behavioral health programs. We have a lot of experience working directly with community organizations and providers to help them partner with both state Medicaid programs and also managed care organizations. Our TA programs have supported nearly every state in the country, including in California, where we do a lot of work providing technical assistance, in particular with Orange County Healthcare Agency and law enforcement, where we're actually helping to increase participation in the MAT expansion project there. Under domains 2 and 7, we can provide hands-on TA to support organizations with workflow design, developing referral pathways, helping to create toolkits and trainings. We deliver trainings and also support workforce strategies. We bring a proven technical assistance and training model that's been honed over 20 years. And we have a lot of experience supporting similar organizations in other states. Thank you. You can find us in breakout room 7.
Thanks, Maggie. We can go to the next slide, where we have Camden Coalition.
Hey team, my name's Carter. I'm with the Camden Coalition. The Camden Coalition is a CBO. We do high-touch care coordination for really complex populations in our community of Camden. We also run a Housing First program. We run a medical legal partnership. We started to manage the HIE and the social information exchange in our region. And so serving complex populations is what we do day in and day out. And we've learned a lot about not only what does it take for organizations to do that well and what sort of programs are needed, but also what are the knowledge, skills, and attitudes that the frontline staff need to be able to build relationships and leverage those relationships with people that have really complex needs. So that's all we do. I want to call out, we have got a handful of instructor-led offerings. So you'll have an instructor with your team, but we also just came out with the Complex Care Certificate, which is online self-paced training, has 9 courses that cover a range of topics that train all frontline providers, nurses, social workers, community health workers, the whole gambit in those essential skills. And it comes with 13 CEUs and it's self-paced. So really easy to fit in your schedule. Come chat with me about the certificate and others in a breakout room that I don't know the number, maybe Jenna does, but hope to see you there.
We will have that up shortly. Thank you. We can go to the next slide, where we have Community Care Cooperative.
Hi, everyone. I'm Annie Pham, Director of Social Health with Community Care Cooperative. We're a national nonprofit company owned by community health centers. Our TA work focuses on domain number 2, social drivers of health. We're drawing on 5 years of experience building and operating local programs to provide services and goods that resemble the nutrition and housing related community supports offered through CalAIM. Through our initiatives, we've developed multi-sector partnerships, including a portfolio of 25 CBO partners and 24 health centers to co-design interventions. We've had success with connecting over 15,000 Medicaid members to these types of services, serving 93% of members who are referred to our programs. I will be in breakout room number 1 today if you're interested in learning more. We can help entities from healthcare to government to CBOs think about partnerships. So how to start them, how to design them, how to implement, and how to improve. I look forward to seeing some of you in breakout room number 1.
Great. Thank you so much. Next, we have Cope Health Solutions.
Good morning, friends. How y'all doing? Pleasure to be here again. I'm Evan King, Cope Health Solutions, a principal based here in Los Angeles. We've been working in the California space for over 20 years across all the Medicaid waivers. Really excited to be part of the CalAIM process. Been working in this area since the beginning of CalAIM back in 2021. For domains 2 and 7, really excited that we have one of the largest workforce pipelines across the state, working with 26 hospitals, multiple educational agencies for the future, developing both training for CW programs, ECM, as well as community supports. We've been working closely with our partners on developing collaborations, working through workflow, as well as designing the right financial models to help them understand their requirements to be successful in these spaces. Looking forward to talking to you more in breakout room number 8. Thank you.
Great, thank you so much. Next, we have Corporation for Supportive Housing.
Good morning, everyone. Good afternoon for those of us on the East Coast calling in. My name is Eva Lerner. I'm a senior program manager focused on healthcare with Corporation for Supportive Housing. We are a national nonprofit that champions supportive housing and leverages its potential to improve the lives of historically marginalized individuals and families. And we do this in a number of ways, including training, technical assistance, thought leadership. We invest in supportive and affordable housing, and we bring together the housing, health, and homeless sectors to advance solutions to ending homelessness through a supportive housing model. And so we are experts in the field of supportive housing and leveraging various forms of service dollars to advance housing goals. So we have been approved for Domain 2 to provide communities, the training and TA around community support services. We can help you understand the housing landscape in your area. We have a team in California, a robust team in California, focused on the San Diego region and Orange County, the greater Los Angeles area, and Northern California as well. So we are very familiar with the housing landscape, with the homelessness systems, partnering with them.
Thanks, Eva.
All right, thanks so much.
All righty. Next we have Elevation Health Partners.
Hi, good morning, everyone. My name is Jessica King. I'm from Elevation Health Partners. I have worked with over 20 FQHCs as the CalAIM subject matter expert for the Clinic Association of LA County. And we are currently working with clients throughout California to strengthen their capacity for ECM implementation. You may know Elevation Health Partners for our work as the coaching team behind the top 3 performing practice transformation networks in the country. Right now, we're working with over 10 clients on the Path TA Marketplace and cited projects. And our workforce projects are tailored for your organizational needs. So we have experience with creating on-demand training programs, tailoring leadership development programs to create the business model and value proposition for transformational projects such as ECM. And we've developed ECM revenue models, QI plans, and dashboarding to help assist this. We also deliver trainings on empathy, motivational interviewing, trauma-informed care, and even use personality assessments framework for True Colors for that leadership development. I'll be in room 5 to answer any questions you may have, and I look forward to working with you.
Thank you so much. Next, we have Foundation Consultants.
Good morning. My name is Janai Moorhead with Foundation Consultants, and we offer practical training to build your capacity to deliver community supports. We also address program development as well as client and case management. For our services, we build capacity for community supports readiness. We offer TA support with managed care plan application requirements and guidance in reporting. And then we also offer training in the delivery of the community supports of navigation, deposits, tenancy sustaining, and short-term post-hospitalization. And why should you work with us? We listen. We have 20 years experience in nonprofit management and program design. We are solutions oriented, and we do have experience in actual delivery of community supports as well as housing first. And we have experience in working with MCPs and contracts. Thank you so much.
Thank you. Next, we have /.
Good morning, everyone. My name is Jeremy Liu. I'm the Chief Housing Officer for /. We're a public benefit corporation whose mission is to solve homelessness by braiding together healthcare and housing resources. We exclusively work with supporting, in this realm, in the TA Marketplace, supporting CBOs to develop their CS services, especially in the areas of housing, all the range of things, including housing transition, deposits, housing tenancy, and day rehabilitation, medically supportive meals, and home modifications. We'll do this through strategic consulting, assessments, planning and implementation, and including assistance with hiring, policy, procedures, and technology procurement implementation. We have a background in Medicaid management, health care provision, as well as housing and housing development. So we're really able to provide a full range of supports to really understand the way your work can really fit into the housing supply and housing community support services area. Thank you. We'll be in a breakout room 2, I believe.
Thanks so much. Next, we have Got This. And just want to confirm that the representative from Got This is off mute.
I'm so sorry. Yes, I am now. I'm Dr. Theo Hernandez with Got This Inc. Can you hear me now?
Yes, we can.
Our mission is to get coping to your fingertips to make it affordable, accessible, and easy to implement coping within a system, from the individual all the way to the way the organization copes as a whole. So we work on the thoughts, the feelings, the behaviors of the institution as well as the individual, and how that impacts the community that we serve. So we have an app that lowers stress and boosts confidence in as little as a minute, called Got This App. And we use that as a tool to be able to help move our initiatives forward. We have some certification programs for health ambassadors, which are basically peer leaders or counselors that are able to implement that work. We work on strengthening teams, and particularly people love having our retreats. We have specific off-the-shelf trainings, including an EMDR training for organizations that have clinical providers that are interested in moving that forward. And really, we work on increasing belonging and connection across institutions, whether people work remotely or in person. So we hope you'll work with us because we meet you where you are. We lift the organization as a whole, as well as the individuals that are part of the fabric of making your work even better. And we want people to be able to do work with a smile.
Thank you so much. All right, we've got the next slide. Next, we have Health Improvement Partnership of Santa Cruz County.
Hi, good morning all. My name is Amy Mencia, Operations Strategist at HIP. We are a nonprofit coalition based in Santa Cruz County who bring together public and private healthcare leaders. Our organization is rooted in systems improvement, quality relationship, and increasing access to care to make our community and those across California healthier. Our TA team consists of staff with a passion for human-centered design, quality improvement, and increasing access to services to those in need. We are partnered with several skilled consultants who we bring into our work to provide the most appropriate services for your organization's need. We offer both hands-on and off-the-shelf services in domains 3 and 7. Particularly in domain 7, we can work with your organization to develop a tailored hands-on project around your organization's TA needs for workforce. Our off-the-shelf services are focused on case management and CHW core competency training, mental health training for non-traditional mental health providers in partnership with EM Consulting, and we focus on providing ACEs-focused trainings. Please do connect with me if you're interested in learning more. I'll be in breakout room 5, and my contact is on this slide. Thank you.
Thank you. Next, we have Health Management Associates.
Hi, everyone. My name is Laura Collins. I'm a social worker and a principal consultant in the LA office with Health Management Associates, or HMA. HMA, including myself, I've been working in the CalAIM space since its inception. Although I'm here to pitch HMA to provide the TA work for community supports and workforce, HMA is also an approved vendor for all 7 TA domains of care to support your CalAIM work. So as I speak, please see the detail on the slide. HMA brings TA expertise across all 14 areas of community supports. Our TA spans from direct coaching, training, development of workflows, processes, and toolkits, strengthening housing navigation services and other transitions, community engagement and coordination, data and billing support, and of course, we can support you in your overall strategic planning activities. We also provide an array of support related to workforce development in CalAIM to help you build, train, and sustain a competent and strong workforce to provide this important work. Sorry about the noise. And finally, why HMA? Again, we have deep expertise and knowledge of the California medical and behavioral health landscape, including the California health plan space. We've already been here helping implement this work since the beginning, and we have the relationships across the state to help ensure that your implementation efforts are truly connected and partnered with your community to support CalAIM, this population, and hope to see you in breakout room 8.
Thanks so much, Laura. Next slide, we have Intrepid Ascent.
Hello, good morning. I'm Alexandra Milliton with Intrepid Ascent. We are a strategic consulting partner for community health transformation based in Berkeley, California. At Intrepid, we help community partners optimize their unique resources to achieve improved health outcomes. We have a proud history of working with healthcare providers, local governments, and CBOs to foster positive changes that address social drivers of health. We promote the adoption of scalable solutions with a person-centered approach and can help you leverage data to advance your health equity goals. We guide our clients to help answer 2 main questions. What programmatic infrastructure and strategies do I need to provide community supports and ECM services? And what technology do I need to do so? Whenever possible, we promote shared local infrastructure that delivers value across multiple programs and initiatives. Organizations that may benefit from our TA include CBOs interested in developing a plan for sustainable service delivery, CBOs contracted with the health plan for the first time, and organizations looking to improve their compliance posture and technology infrastructure. If you're interested in learning more about how we can work together, I encourage you to join us in breakout room number 3.
Thank you so much. Next, we have Leah's Pantry.
Hello, I am from Leah's Pantry. First, I want to say that we are not a food pantry. Don't get confused by the name. We are a nonprofit and we train other organizations and nonprofits on how to take a trauma-informed approach to their community nutrition work. So services that we offer on the TA Marketplace is to train you on how to run our nutrition and cooking community workshops. These may be called Around the Table or Food Smarts. These workshops focus on building cooking and nutrition knowledge and skills, and they can be run with participants of all ages. The workshops have been run with over 150,000 participants across the US. So they are well tested and well loved in communities. And they can be implemented in a flexible way so it can fit in to whatever your current programming is. We also offer off-the-shelf and custom capacity building training to teach you how to take a trauma-informed approach to your work, whatever that work is. So why work with us? We offer tested and easy-to-run community workshops that are built with a trauma-informed approach already. We are the leading voice in trauma-informed nutrition, and we have a lot of experience training professionals to do this work. So I hope to see you breakout room number 1. Thank you.
Thank you so much. Next, we have Maeda Consulting.
Hi, I'm Katie from Maeda Consulting. I love doing these 2 domains. We are an organization that focuses on empowering people who are delivering the service. We believe that first stems from leadership development, which is what we love to do to be able to build that up. Our mission, if you see it there and up above my little head here, is equipping those who are willingly face the fire to create authentic change. So we've developed a curriculum that is all of the emerging practices that are happening that include fidelity tools and amazing workshops that we engage this modern workforce and teach leaders really how to lead versus manage, because this is the new way that we're doing things. And we love to create tools to make everybody's life easier. Our goal is to get you back at least 20% of your time by making efficient systems in order to make that happen. So we will be in room 8. Hope to see you there.
Thanks so much, Katie. Next, we have Pacific Clinics.
Hi, good morning, everyone. I'm Audrey Reed Brown with Pacific Clinics, and we are a large community-based nonprofit, and we've been providing behavioral health and social services to underserved communities in California for over 150 years. We provide services to all age groups in 22 different counties. We have employees who speak over 20 languages, and we've been in the CalAIM space providing ECM and housing services since the early days in 2022. Our primary lens is not a consulting firm. We are a community provider doing the work. We love making a difference in the lives of the people we serve, and we're passionate about supporting others to also be successful in delivering these services. We do have a training institute, and we offer foundational skills training such as motivational interviewing and trauma-informed care. We also have certification programs such as housing navigation, care management, and peer support services. We have SMEs across many services, and we're willing to work with you to create whatever type of training you need for your workforce. We can provide CEs for professionals, and we have extensive experience training paraprofessionals and those new to the field. Connect with us to discuss your needs. We're here to partner with you. See you in breakout room number 7.
Thank you. Next, we have Policy to Practice.
Good morning, everyone. My name is Christina Nolf, and I'm a licensed clinical social worker and the founder of Policy to Practice Consulting in Long Beach, California. For Domain 7, I created CalAIM 101, which is a 45-minute training video that introduces workforce members to the role and value of community supports and enhanced care management within the larger picture of CalAIM. This training is comprehensive and easy to understand, covering the basics of the Medi-Cal transformation, including its history, goals, values, and components, key concepts such as whole person care, social drivers of health, and population health management are also covered. CalAIM 101 helps your workforce, especially those on the front line, prepare for and connect complex requirements with the delivery of high quality, equitable service to their communities. Thank you, and I will be in breakout room 6.
Thank you. Next, we have Quantified Ventures.
Everyone, my name is Chester and I'm with Quantified Ventures. QV is a consulting firm that has extensive experience in supporting organizations implementing CalAIM. So on the TA marketplace, we have both off-the-shelf and custom options for current or potential CS providers. We specialize in helping you design and optimize, and most importantly, creating sustainably financed CS program. So we assess program models, develop value props, and recommend how your organization could maximize the outcomes that you're doing, and align that with payers to ensure sustainability and not rely on grant funding over and over and over again. So we've worked across nearly all populations of focus and all CS support providers throughout the state, and have a pretty good amount of experience in doing so. So we'll be in breakout room number 3 and look forward to talking with you more there.
Great, thank you so much. Next, we have Regional Asthma Management and Prevention.
Hi, everyone. I'm Joel Irvis with RAMP. We are a project of the Public Health Institute. Our TA focuses specifically on asthma remediation. For over 20 years, we have provided TA for asthma home visiting services, and we know that they improve health outcomes, reduce healthcare costs, and reduce health disparities. We are here to help you design and implement effective asthma remediation programs in support of people with poorly controlled asthma. Recently, we were the TA provider for a 3-year, $15 million asthma remediation initiative funded by DHCS. RAMP also led a sustained effort in support of DHCS adopting the asthma remediation policy. We've worked with a diverse range of organizations and agencies. We use our combined program and policy experience to build on your organizational strengths. Our approach includes direct TA, tools and best practices from the field, and connections to a peer learning network. We're invested in asthma remediation and want to see you succeed. I hope you'll reach out to us and look forward to talking with you in breakout room 4. Thanks.
Thank you. Next, we have Sherry Brenner, Health Systems Consulting.
Thank you. It's such an honor to be here today with you all. I'm Sherry, and I've been on the ground working in public health in Northern California for over 20 years. And I'm here today supporting Domain 7, Workforce, because I think the vision of CalAIM is brilliant. Medi-Cal transformation to pay for the things that folks really need is what brings me here. And clearly, you're all here for the same reason. Yes, CalAIM is brilliant, but it's messy and hard. Having the right staff who are there for the right reason and are well supported and love their work, that's the thing that's going to make this all successful. With decades of experience creating and supporting successful teams, I'd love to help support your team, starting with wherever you're at today. Our community members deserve the best that your staff has to offer, and that takes ongoing, intelligent work. I will be in breakout room 4, and I hope to see you there.
Thank you so much. Next, we have Signal P.
Hello, everyone. By the way, hope you're doing all right. By my count, I think we have about 6 more people after me. So you're doing great. Thanks for hanging in there. Great to be with this group. My name's Hunter. I am the sole instructor and coach for my work supporting organizations that I think sounds like I'm similar to Sherry in that I want people to get through this complex change safely and in a healthy way as a team of professionals. My work supports people in the healthcare and social service safety net. I'm a social worker like Laura and Christina are, who spoke earlier. And I've worked on all the different things within CalAIM, but what's different in terms of what you would get working with me within the TA marketplace is that I work on the general human factors, helping people get through the work in a healthy way, as I said. And I support mostly people who lead from the middle of organizations, who I think have the hardest job in this work and get the least opportunities for support, because usually leadership development is very expensive. Leadership is hard, and
Thank
learning about
you.
it should not be, is my motto. And when I do all the teaching myself, we use real life scenarios
Hunter.
and we use application homework between the sessions to make it real. Thank you.
Thank you so much. Great. Now, next slide, please. We have Smith Bernardin Consulting.
All right. Hi, can y'all hear me? Beautiful. So I am Shannon Smith Bernardin. I'm a little bit different, I think, than many people in the room. My work is very, very specific. I am a registered nurse by trade. I have worked in sobering care for acute intoxication since 2007. I ran the San Francisco Sobering Center for about 10 years and specialize in working with communities that are trying to work with individuals who are higher users of the system, individuals who are intoxicated in public, that are being cared for by law enforcement, jail, and emergency departments. My work, I'm currently with UCSF. I co-founded the National Sobering Collaborative, which is a nonprofit that brings together sobering centers across the country. And what I'm here for today is helping you create sobering centers. It's one of the Domain 2 benefits. And the work that I can do can be as simple as coming in for 4 to 6 hours, for example, to help out any of these actual other consultants we've heard from today as a subject matter expert around who needs to be at the table for your sobering care. Can we do a cost benefit analysis? What's the data you have? I have a doctorate and I often do a lot of research on sobering. What do you need in your community to make this beneficial? How do you put together protocols? Do you need a training for staff that are going to start a sobering center? And I see I might be getting cut off at this point. So reach out anytime. I'd love to work with you. Thank you.
Thank you. Next, we have social finance.
Folks, pleasure to be with you all. I'm Ryan Erickson. I'm a director at Social Finance. And just really briefly, our bread and butter is in creating outcomes-based contracts. So, reducing the complexity of services, particularly services built around health-related social needs, and creating structures, contracting structures, and performance management structures that help bring day-to-day activities that you have as a CBO or as a government partner in line with your ultimate service goals and create the tools needed to track that progress. So we're based in San Francisco in California, though we are nationally. We've done this work in quite a few different places across the state, and we're particularly interested in the intersection between economic mobility and services for health-related social needs. Anyway, thank you very much, and I'll see you in breakout room 1.
Thank you, Ryan. And we've got about 4 more vendors. So next is Therapeutic Play Foundation.
Hello there. We have made it to a wonderful new day, and I'm so excited to introduce myself. I'm Nakia Fields. I'm a licensed clinical social worker, registered play therapist, founder and acting executive director of Therapeutic Play Foundation. TPF is a nonprofit that focuses on empowering wellness in historically under-resourced communities through play. And what we believe play is to be present joyfully in the moment. And that means that you're feeling healthy when you're able to be present and joyful in the moment. And we believe that health is starting with the foundation of mental health. And if you are unable to feel well and think about being well and taking action to be well, then it impacts all other areas of your life, including your physical health and your relationship health and your systemic health and your community health. So that's why our whole client is the entire community of Southern California. That's where we serve. We serve children, mothers, fathers, grandparents, in truly accessing the care that they need. And now we've extended our reach as technical assistance providers to other partners in the community who see gaps out there in the world. So please do reach out to us at Therapeutic Play Foundation in breakout room number 6. And we'd love to answer your questions and customize for you of how your CBO, your organization can step into the gaps.
So much. Next slide. We have Think Tank.
Good morning. My name is Marlo Fox with Think Tank. I don't know about you, but I want to reach out to Therapeutic Play. I was inspired by that presentation. So our mission is really about equipping groups to rethink poverty and partner directly with those impacted to create change. And so we know many of you on this call, your goal is to provide quality community support to people navigating the complex dynamics of SDOH. However, sometimes your outcomes aren't what you're aiming for. And one obstacle that we've seen is that there can be a disconnect in the understanding of the day-to-day lived realities of those that are navigating SDOH. And so what we have to offer is we've touched over 100,000 people with our training. We have very immersive training experiences, both virtual and live, poverty simulations that touch all aspects of individuals' lives and certainly center on the social drivers of health. And so with that, we can customize your experience to your context, and we also have additional follow-up resources for activation. All our training is grounded in lived experience and designed with those who have navigated these realities. So we've got a couple of quotes here from customers on the slide. We hope you read those and are inspired and join us in breakout room 1.
Thank you so much. Next, we have Transitions Clinic Network.
Hi, everybody. My name is Anna Steiner. I work for Transitions Clinic Network. We are capacity building organization that really supports people at the intersection of health and carceral systems. Our expertise really lies in transforming health systems to better serve individuals returning from incarceration. And for workforce development, we've developed some specialized tools and training that really is focused on hiring individuals with lived experience of incarceration. So working with HR systems and best practices around that, training individuals as community health workers and peer support specialists to provide care to others coming home from incarceration, and then working with systems to integrate community health workers, particularly those serving the justice involved population. Please join us in room 6. We'll have some of our technical assistance providers. Our team is composed of majority people with lived experience who are providing this direct service provision. Thanks so much.
Thank you. And our last vendor pitch is True Management Services.
Hi, how are you doing? How everybody doing? True Management Services mission is to identify and secure financial resources for community-based organizations and local governments. Since 2021, we've assisted agencies to become CalAIM contractors. We've been providing TA, the marketplace, as a marketplace vendor since August of 2023, and we currently have provided over 100 approved projects. We offer 15 off-the-shelf products across 6 and 7 domains. Proof of our effectiveness is that 13 to 15 or 95% of TA recipients we've received our TA has signed up for additional projects. Our domain 2 and 7 offerings include the following off-the-shelf projects: planning and implementing the housing triad, establishing a sobering center, adding recuperative care and short post-term hospitalization, and staffing up for CalAIM, and working with the individuals transitioning out of incarceration. If you want to learn more, join me and members of the True Management Services team in breakout session 8. See you there.
Great. Thank you so much. And thank you to all of our vendors. I know it is not an easy task to provide such a short pitch, but we thank you for your time and putting together that slide. So next, we will be discussing the breakout rooms and then moving to those breakout rooms for the next 30 minutes or so. So just a quick overview, breakout rooms are an opportunity for all attendees to ask questions specifically to the TA vendors in those rooms, and you really hear about more detail regarding their projects and services within the 2 domains. So today, community supports and workforce. We do request that all attendees use the raise hand feature, which is at the bottom of your screen, to ask questions once we move to those breakout rooms. A member of the TA Marketplace team will call on those attendees with their hands raised and ask that you come off mute to ask those questions. We do ask, just to minimize background noise, that everyone remain muted unless you're called upon. We will send messages to all breakout rooms at the 5 and 1 minute marks, as well as when we're moving from the breakout room to the main room, and that will occur at 10:15. Lastly, my final plug, to please ensure that you have that Zoom application downloaded to your device in order to make sure that you are able to participate in the breakout rooms. So if you've joined by phone or browser, please rejoin via Zoom at this time. Next slide. So attendees will be automatically assigned to a random breakout room. However, you are able to move throughout the breakout rooms during the 30-minute period. We will have an example of how to do that on each of the breakout room slides once we move to those breakout rooms. But generally, what you should do is find the breakout room key at the bottom of your screen. You will click that. And then once you click that in the Zoom application, all the lists of breakout rooms will show up and you simply click join. Again, we will have a list of all the vendors and where they are located so you can easily identify which breakout room you would like to go to. Next slide, please. And here we are. So a similar slide to this one will appear in every breakout room. I will just note that this is slightly different than we have in the past, given that this is focused on 2 domains. So we've broken it out by vendors out by the domain for which they are approved, with breakout rooms 1 through 4 focused on domain 2, which is community supports. Breakout rooms 5 and 6 is focused on workforce, domain 7. And then breakout rooms 7 and 8 have vendors that are approved in both domains, so both community supports and workforce. So that being said, I think we can pause our recording and we can have us move to the breakout room sessions.
Great, thanks, Jenna.
All right, thank you everyone. Welcome back. I hope that you all had a really great time engaging with all of the different vendors here today. I think today is the most vendors we've had on one of these calls, so it's really great to see the vast vendors that we have on the TA Marketplace and the resources available. All right, if we go to the next slide, I am just going to share a few resources for everyone regarding the TA Marketplace in general before we open it up to Q&A. So first, I just want to show you our homepage. The TA Marketplace homepage gives you a really good overview of everything that you need to know about the TA Marketplace, some information about our vendors, the different project types we have, those different domains. So if you need something beyond community supports and workforce, we got some information about those domains. And then we also have a step-by-step guide about who and how to use the TA Marketplace. Of course, if you have any other specific questions that you cannot find on the website, please feel free to email us at the TA-marketplace@ca-path.com. Next slide, please. Did want to show everyone our vendor profile cards. So if you navigate to the vendor page, a list of vendors will appear. And if it provides just a very succinct overview of a specific vendor, the different domains that they are approved for, as well as some basic contact information. And once you click on the actual name of that particular vendor, and Cope Health Solutions is our example here, you will see more information about them, a larger summary about their experience and what they can offer, a list of those domains, but also some client testimonials sharing, organizations like yourselves and their experience with these TA vendors. Next slide, please. All right, so once you're ready to get started and think you're ready to find a vendor, find a project on the TA Marketplace, you just need to click Explore the Marketplace, which appears at the top of the webpage on every single webpage on the Marketplace or even the PATH website. So once you click that, you will see a ton of different projects, also all of our different vendors listed. You will see the project name. So in the example of an off-the-shelf project, once you click that project name, some more specific objectives for that project are provided. So you're able to see whether this project really would meet your needs or whether you would need to go see if this vendor provides hands-on services in the domain that you are looking for. Once you are an approved recipient, you'll see that Apply to Unlock button will disappear, and you will actually be able to select that project and just go right ahead and submit your project eligibility application. Next slide, please. Additionally, some extra support in navigating the TA Marketplace website. We do have some filters. So we have filters for the different project types. So whether that be the off-the-shelf, hands-on, we also have filtering by domain. So if you're looking for community support, you can select the community supports domain. But we also have different domains for like TA needs. So if you're looking for a vendor that supports billing, we have that filter. We also have filters for different services, populations of focus, etc. So please be sure to use the filters if you're looking for something very particular. Additionally, if you know the vendor that you would like to work with, we do have a find vendor tool that you can easily locate that vendor. They are listed in alphabetical order, and you can select that vendor and it will take you to that vendor profile page. All right, next slide. All right, so TA recipient eligibility. If you are not already, the first step to using the TA Marketplace is becoming a TA recipient. So our webpage does provide all of this information, but different types of entities that can shop the Marketplace, CBOs, counties, FQHCs, tribal or designee health, Indian health programs, different providers, but also others approved are approved by DHCS. So feel free to apply, and we will be sure to make sure we put in front of DHCS your application. The other piece that is required as part of this application process is information regarding your contracting status with managed care plans. So we will be looking for either a signed attestation form and the signed form that shows that you are contracted with a provider, or sorry, MCP, or a signed attestation saying that you are talking and engaging with a particular managed care plan. And that does require the signature of the managed care plan. However, if you are not yet at that stage, but you are hoping to get contracted with a managed care plan, DHCS will approve those who are providing these services and looking to get contracted with a managed care plan. So there are instructions on how to request that approval. It's a simple email application to the TA Marketplace team. And again, all the information regarding eligibility is available on the TA Marketplace website. Next slide, please. All right, so we do want to open now for Q&A. This is general Q&A about the TA Marketplace. Any questions you might have about recipient eligibility, applications, etc. And I'm going to just look and see if we've received any so far.
Not seeing any open questions yet, Jenna. First time, we're staying on top of it. Let's see if any of the answered. Nope, nothing. Jumping out.
And I will just flag to please use the Q&A feature. Unfortunately, attendees are not able to come off mute.
Oh, here we go. There's one. So to clarify, are you able to pick multiple solutions on the marketplace? Yes, absolutely. They can be from the same vendor. They can be from multiple vendors. We've seen that work both ways, where a recipient will either have multiple vendors working with them, or they'll have multiple projects with one vendor. It's really whatever you need to be delivering the highest quality ECM or community support services in your community. So if that means getting an assessment from one vendor and an implementation plan from another, or billing help from one vendor and workforce trainings from another, that is all possible. Or you may find a vendor who you really like, and they've helped you with your plan, and now they're going to help you implement, and they're going to do the trainings for your staff. We've seen that all across our already approved projects. Great, Tatiana. Not seeing any other questions coming in yet. Oh, okay. We've got some great questions here. So what funding is used to pay the TA vendors? So The TA Marketplace is completely funded under the PATH initiative. So there is no cost to a recipient to receive these services as long as they are contracted through the marketplace. So if you reach out to a vendor independent of the marketplace, that isn't going to be covered by the marketplace. But if you go through this process where you become a recipient on the marketplace, you submit a project eligibility application, your vendor submits a scope of work and budget, and it is approved, it will be 100% paid for by the TA Marketplace. All right. How long does it take for vendors to get paid? So the invoice does need to be submitted and approved. We pay invoices on a monthly basis. So if that invoice is approved ahead of that next monthly payment, it'll be paid on that next invoice cycle. Okay, this is a complex question and I don't know the answer, but we can certainly get back to you, Jamie. So Jamie wanted to know, for SUD services, they contract with the county and they bill the county, who then bills the managed care plan. So how does CalAIM change that? So for SUD services, nothing should be changing. This program focuses on enhanced care management and community supports. But if you're talking about enhanced care management and community supports for SUD clients, you might be contracted with the county. The county may be the contracting entity for the services. So if that is the case, and you're looking to become a recipient, it can be the county, which is the contracting entity, that would be signing your attestation. It does not need to be a managed care plan if it is in fact the county you contract with to deliver the service. Let's see. Great question. So what's the turnaround time from application to approval? So at the time when you submit your project eligibility application, it really only takes about 10 days for it to be approved through the TA Marketplace, assuming that there's no issues with the application. So what we found is sometimes the goals aren't very specific in the application when it's first submitted, or we need more clarity on the scope. Like the project may seem too large to be implemented in one go. And so what we'll do is we'll send it back for resubmission. So that can add to the timeline, but really a perfectly clean, approvable project eligibility application is usually approved in about 10 days. And then it goes to the scope of work and budget process. And then in the scope of work and budget phase, if you're already working with your vendor and you've been communicating with them, they may have that scope of work and budget ready to go and submit it right away. However, if you are not yet working with that vendor, it's going to take them some time to create that scope of work and budget, which can extend the timeline. But again, if you have a fully approvable project eligibility application, a vendor who's ready to go, and they submit the scope of work and budget right away, it's like 2 weeks of review and scope of work and budget. So it really can be done in under a month if everything is approved immediately with no errors, if things need to go back for rework, or if a vendor's not ready to submit the scope of work and budget on day one, it can extend that timeline. All right, recommendations on software. So just to clarify, the TA Marketplace, you cannot purchase software through the TA Marketplace. It's only support services from vendors. So that said, many of our vendors offer support completely agnostic to the software solution you use. So if you are looking for an EHR software or an analytics platform or a billing software, a vendor might be able to recommend one to you and help you to implement it, but you will not be able to purchase a software from a vendor as part of the TA Marketplace. Okay. Oh, is there an instructional video for recipients to walk them through the application process? That's a great question. So we do a quarterly recipient webinar where we walk through all of these different procedures. Our last recipient webinar, I believe, is recorded and on our website, on the TA Marketplace website. So you can watch a recorded version of that initial training to recipients. That said, if you want more specific information or you want to work with someone from PCG, we can, you can just reach out to us via the TA Marketplace inbox and we can get you started. So you know what the first steps are you need to take to get into the marketplace and to get connected with a vendor.
Great, thanks, Trish. I just want to flag that I also put in the answered questions chat the direct link to our resource page that has the walkthrough of the project eligibility application. So this will be exact screenshots on how to sign up and then submit that initial application for recipients.
Perfect. Thank you, Danielle.
Thank you. And Trish, I'm just noting the time and not seeing any new questions coming in. So I do just want to maybe do our closing remarks. So if we move to the next slide, and please, if you do have any questions that did not get answered or you didn't get the opportunity to ask them, please just email the TA-marketplace@ca-path.com, and we would be happy to answer any of the questions that you have. So this is just a plug for our final TA vendor fair, which is going to be held on Thursday, April 25th at the same time, 9 to 10:30 Pacific time. This is going to be focused on domains 5 and 6, which are health equity and supporting cross-sector partnerships. Registration for this event is available on the TA Marketplace under upcoming events. Next slide. And we do really would like to hear your feedback regarding these events. So this is just another plug for the survey for the TA vendor fair. The survey link will be sent to all attendees today, but feel free to scan this QR code now to access it. And we would really love to hear your feedback on this event and any other feedback that you would like to share regarding the TA Marketplace. And next slide. And with that, just thank you again for your time. Thank you to all of our vendors today for joining us and providing such great presentations. We really appreciate it. And we hope to see you soon. Sign up on the marketplace utilizing these services. Thank you.